I think we're ready to keep going. There's going to be a lot of information circulating again, lots of things happening today, so we should keep pressing. Hello, my name is Yves. I'm cardiac surgeon. So I'm going to talk to you about liver and renal issues. The next session is about more the nitty-gritty things of the Fontan circulation, complications, what can happen. And I think that when we had our first education days, we had the concern of, cracking bad news, using some hard terms. And it's true that when you hear words like death, transplantation, for every one of you, I'm sure it's a bit of a shock, but somehow we have to talk about things, and we try to give it in a reasonable way, but be concerned that sometimes some words are spilled out, and you don't have to be scared about it. Especially, I think it's still better to have the information. So I've made some warnings about adult themes and strong language, and I have to disclose some consultancy fee. Every talks you give, you have to disclose that, and I'm actually proud to work with these companies. I have always to sign some confidentiality agreement, and I cannot say why I'm involved with these companies, but anybody who's looking for about 10 seconds about my profile in research and knows the companies can understand about 15 seconds what it is all about. Just to tell you, I don't get much from it so far. So. I'm a cardiac surgeon, so I'm going to talk to you about things that are not related to cardiac surgery and are outside my field of expertise, but I'm probably closer to your point of view than the point of view of nephrologists and hepatologists. I see it with a very simple eye. So Prem beautifully explained to you the Fontan circulation. You understand the issue. We have only one pumping heart chambers. These pumping heart chambers pump through the body and through the microcirculation and still generate higher pressure into the veins. And that's the main driver of the blood to go directly from the veins through the lungs. You and I, the people who have two pumping heart chambers, the right ventricle would pump the blood into the lungs in the Fontan circulation, and it goes passively, so there's congestions in the veins. The way I explain that is that when you have this congestion in the veins, it has an impact on some organs, and the main organs we've been looking at so far are the liver and the kidneys. And the way I compare things is that imagine what high pressure in the veins makes to you. You all played that game at some stage in your life, and you can feel after a few minutes your head bursting out. So it's not the same amount of pressure, but imagine what it does to your liver and kidneys over your lifetime of a Fontan circulation. So it's going to have some impact. And we know that it has an impact on the liver since very old works that has been done in heart failure. If you have a failing heart, you have the same issue, congestion of the blood in the veins, and it has an impact on the liver to the point that some people were described to have liver cirrhosis. Liver cirrhosis is having a lot of scar tissue in your liver. Like if you drink alcohol like a madman, you end up with a shrink liver full of scar tissue. Or if you have hepatitis, then if you have chronic hepatitis, you can have the same destructed liver and scar tissue in your liver. And if you have a cirrhosis for many years, you can have liver cancer as well. So some first liver cancer were described in Fontan, and everybody got very excited, and in all communities said, oh, we have to look at the liver of the people with a Fontan circulation, it's terrible, they may all get cancer. And so we wanted to investigate that. So we had some money from the NHMRC to look at the liver and the kidneys of people with a Fontan circulation. We want to determine, without being invasive, without a biopsy, without getting tissue from the liver, but to see what amount of fibrosis, cirrhosis, and maybe cancer or lesions that would lead to cancer we could have if we look at all the people who would be happy to participate to the study in Australia and New Zealand. And so we wanted to look how well the liver function as well, and we want to look at how many people we could detect, in how many people we could detect renal diseases with. The examination we did was the FibroScan, and I will explain that. That detects the amount of scar tissue in your liver, of fibrosis. We did a very precise scan, a nuclear scan, to analyze the renal function. So it looks at glomerular filtration. And the way I understand things is your kidneys are like a big filter. The glomerular filtration, the one we said in the middle, the nuclear scan, it sees how much blood you can use, how much blood goes through your filter. And if your filter is plugged, then there's less blood going through the filter. And if your filter is damaged, it's broken, then you can leak stuff. There's some things that will go into the urine, and it's going to be protein, and then you have a different urine albumin creatine ratio. We did also usual stuff, ultrasound. We look at liver function test. We did take the pressure in the veins, because was the biggest reflection of how your Fontan circulation works. If your Fontan circulation does not work well, your pressure in the vein will increase. So we'd like to see if there was a correlation, if it was the same, if the people who had high pressure in the veins would have more liver and renal lesions. We look at clotting factors. We look at the heart as well to detect anything. That's the FibroScan for those who participate to the study. It's a 10-minute examination, at least I would hope so. And you can hear clicks as the machine sends ultrasound waves, and it goes into the tissue and it is reflected. So if you have a lot of pool of blood, or if you have scar tissue, it's reflected to the machine and we record that. And then you can see that as we have the number, you can be put on a scale of KPA that you see at the bottom. And if you're on the left side of the screen, then you're good. On the right side, you're not good. And you in between the two, when you're getting in between 9 to 12, you're in between the two. So we had 152 participants, which is a large number for this kind of study, with a mean age of 20, so the average age was 20. It was an average of 15 years after Fontan. And we compared the people who participated to the study. It was representative of the population of Australia and New Zealand with the Fontan. So it's a good representation of everybody. So we found a feature suggested for hepatic fibrosis, so having some scar tissue in up to 60% of the patients. But they were quite, we know that after Fontan, with increased venous pressure, you have these scar tissue in the liver that did not come as a surprise. We had features of portal hypertension in 29%. But portal hypertension is that when you have a liver cirrhosis and you have scar tissue in your liver, the blood that goes to the liver is congested. And that's what we call the portal system. And that's what we call portal hypertension. So the blood, before it gets to the liver, is congested. But you have a Fontan, so you have 4 or 5 times the pressure in your veins than normal. You're going to have a high pressure in the veins. So that may be a sign of disease, but that may just be in the Fontan circulation a sign of having a Fontan. If you have Fontan, you have high pressure in the veins. That's how it works. The good news is that there was no discrete liver lesions. There was no signs of lesions that would make us fear any cancer in the liver. None of them. If you look at the distribution of the FibroScan, you would expect people with normal liver to the majority of them before 5 and 15, and you can see that there's a spread of the people with a Fontan from the 10 to the 15 to the borderline values to higher up. But you have to know that if you have congestion, so if you have more blood staying in your liver, which you have if you have high pressure, if you have a Fontan circulation, so that will give you an artificially elevated number. And when you look at the liver function test, yes, they were mildly abnormal. You look at the things that you look to see if you're drinking too much, or if your liver is functioning well. They're mildly abnormal, but only very mildly so. We did not have patients with clearly dysfunctional liver that were not functioning. The liver is the machine that makes all the protein blocks of your body. It makes all the bits, all the structure of your body. and it does its job correctly. The coagulations were normal. There was no vast differences. And yes, if you do a fibro test score is a mix of different blood analysis in the liver that tells you if you have chances to have fibrosis in the liver. And up to half of them, 46%, had a fibro test score signing the existence of fibrosis. So it's not normal in half of the patients. If you look at the kidneys, the glomerular filtration rate was abnormal in 37% of the patients. So a good third of them have abnormal filtration, job of the kidneys. But only mildly so, nothing severe. If you look at the proteinuria, normally you keep the protein, you shouldn't have protein in urine. Well, same number, 37% had protein in the urine. The thing is that of the patients who had both tests done, only 15% had both the filter capacity that is decreased and protein in the urine. But if you add up, if you look at all the patients who have at least something abnormal, yes, about half of them have either one of the two that is abnormal. What is the influence of that? What influenced that? Well, what we've seen is that if you have higher pressure in the veins, well, you have higher chance to have a decrease, an abnormality in your kidney and an abnormality in your liver. And the other thing is that with time, so the more time there has been between the Fontan and the test, well, the more abnormalities, the more abnormal is the things that you detect. But look at the range. You see all these dots from the top to the bottom? They're not concentrated. The scatter is enormous. So yes, this is the trend with time, but it's not like it's not very clear yet. Same with the capacity of the filtration. Yes, grossly speaking, it tends to be decreasing, but there's a wide scatter as well. What do I get from this data? And we had the paper rejected once from a journal, we're resubmitting. I had to rethink about it in the last 2 weeks and to see the substance of the numbers. We had lots of numbers. I'm really summarizing what we're getting. What we see is that after 2 decades of Fontan circulation, half of the people will have some abnormalities of the liver and the kidneys. So we can detect something in half of the people. But these abnormalities are only mild up to this stage. We did not find any catastrophe. And more important than anything, we did not find any dangerous cancer-type lesions in this patient. We know that's a possibility, we know that it might come, but not in the time frame that we had in Australia and New Zealand. What do I get? Well, it's normal that we see that. I would not imagine to have a Fontan circulation, to have venous pressure that is 4 or 5 times the normal and not seeing any difference in your body. That's stupid, that's inconceivable. It's the same if you walk bare feet for the whole summer, you get a thick sole, you create scar tissue under your feet. You have high pressure in the veins, your body will build up something to fight against it. It's normal. You have higher pressure in the veins, your kidneys are not functioning normally. We know now that we can detect abnormalities in half of the people. We don't know yet how much it's going to impact your capacity to live a long life or will impair your quality of life. That we haven't determined yet. So what should we do? What should we test? I can tell you we can detect some abnormalities, but we have no solution for it at the present stage. One thing is sure is that cancer may develop at some stage in some people, even if it's super exceptional, it may happen. And so I think we should check the liver at least starting in the second decade. So you should have some imaging of the liver. And you can debate whether it's ultrasound, CT scan, I don't know exactly, not my area of expertise, but I think you should have a look at it. Liver enzymes, we're not going to do much about it, so we can look at it and you have mild abnormalities. It's not going to change your life. Kidneys, I don't know. We're not going to, again, do something. We're going to start some trials. So the one drug that is effective when you have any kidney issues of any origin, whether it's diabetes, high blood pressure, whatever, is ACE inhibitor. It's the drug that we use for high blood pressure that I was talking about. And so that is an indication where we should try to see if it has an impact on the renal function. But unless you know that you have abnormal renal functions, you're not going to try. So I always say this joke of, the guy who's falling from the 13th floor, and at every floor is heard being saying, so far so good, so far so good, so far so good. I don't think that you have to wait to hit the wall to try to investigate. Yes, we can do a lot of investigation, and at the present stage, we don't know. But unless we collect a lot of data, we're not going to know what we have to do. So even if it's a bit scary, I would say, check the urine. A urine dipstick is less than $1, I think, of cost. I mean, who's got a Fontan circulation in the room here? Can you show me a show of hands? Okay, who also is a parent of somebody with a Fontan circulation or has a Fontan circulation? So how many of you had a test of urine ever? So I would say a quarter, not even, maybe. Doesn't cost a lot. Do you want to try? I'm back to the same things, It's not what... you have to know what you want to do for your Fontan. I would investigate. Thank you very much.